Everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today, I'm here with Manav Sevak, the co-founder and CEO at Memora Health. How are you today?
Good. How are you? Thanks so much for having me on.
Absolutely. I'm excited for us to chat. Doing well. Uh, I think we should dive right into it. We like to keep these short and sweet for our audience. So it'd be great if you could tell the audience a little bit about yourself, and then we'll talk more about Memora Health.
Yeah, absolutely. No, thanks again for having us on the podcast, and thanks for um, allowing us to tell the Memora story. A little bit about just myself. I'm one of the founders and the CEO of Memora, scientist by training. So prior to Memora, I was a computational biologist and studied biochemistry and computer science, and have focused on building out Memora over the course of the last 4 years. Historically, come from a family that has quite a few folks in the healthcare industry as a whole, and have had quite a bit of exposure to it, and have always wanted to spend time in the healthcare industry. Had a chance to explore, from the policy perspective, from the technology perspective, from the care delivery perspective is something that we took into consideration as well, and realized that the opportunity to do so by building a technology company was one of the biggest in terms of the scale of impact it could have. And that's a little bit about how we even got here today.
And so you gave us thank you for your background. Really appreciate that. And then talking a little bit more about the platform. What we like to do is we like to focus on three key things whenever we have a guest on: the why, how, what. You already went into a little bit about that, but for those other gaps, if you could fill in kind of based on that format, we really appreciate it. I know our audience really loves continuously learning. So you already gave us a little bit about the why. Maybe you could break it the platform down a little bit into how things work today, and then maybe how you envision things even evolving from here.
Absolutely. So a lot of the kind of reasoning behind starting Memora was very focused on the fact that we had seen a lot of firsthand and secondhand challenges around care delivery as a whole, and had the opportunity to actually see somebody very closely go through a pretty complex healthcare episode, which gave us a lot of sense of the fact that there's tons and tons of new digital tools that have started to appear in the healthcare ecosystem. But even with the penetration of a lot of those different tools and the presence of a lot of those different tools, the process is still just fundamentally broken for a lot of patients and for a lot of care teams. And we spent a lot of time trying to understand why that's really the case. There's tools that have appeared across scheduling and remote monitoring, and there's patient portals, and there's messaging tools, and tools around triaging patients much more efficiently. And regardless of all of those, the process for how care teams still manage patients, especially for our sickest, most expensive patients in the healthcare system in the United States, it's still extremely challenging and extremely demanding of those care teams. So one of the big reasons that we really reflected on was the fact that it's challenging because there's not great infrastructure in place in those healthcare systems to support, manage, and kind of track patients after they've left the hospital or outside the walls of the clinic. And a lot of that infrastructure right now, is embedded inside the medical record, and a lot of it relies on the EMR when the EMR is not necessarily built to do that. So broadly, Memora plays the role of being that infrastructure, and that's what we've built Memora to do. So what we really do as a company is we work on digitizing and automating complex care workflows, and very much work towards a mission of making care much more actionable, accessible, and always on. The way that we do that, and a little bit of the just what of the platform, is we primarily work with large healthcare systems and think about the populations that Memora impacts primarily as the patients who are traditionally the most complex and the patients who traditionally need the most resources. We go into healthcare systems and take a lot of the existing data that is generated around how those patients are actually managed. So we'll take things like phone call recordings, what escalation workflows and symptom management guidelines are used to manage those patients, what natural kind of educational pieces of information are administered to those patients in the booklets that they receive when they're discharged, lots of different guidance around what frequency of phone call should be made to patients, all of those different steps that to some degree help inform what's the gold standard of how a patient should be managed after they've left the walls of the health system. And Memora helps digitize a lot of that. So what we'll do is we'll take a lot of those disparate processes, and a lot of that disparate information and convert it into these very concrete messages that go out to patients entirely just over text message, as simple as possible. And then second, automated tasks that help determine what should be escalated and documented directly inside the medical record. So to some degree, Memora is taking a lot of the manual work that goes into an entire set of care management and just care coordination workflows right now in a care delivery setting, and helping to, one, make it significantly more efficient and streamlined directly through software. But then second, making sure that Memora is kind of built in a way that it's empowering care teams to actually focus on clinically relevant data and focus on meeting patients where they are and addressing patients that are the highest risk.
And what impact does that have on the healthcare ecosystem kind of broadly?
Sure. So there's three, I would say, really big areas of impact that we focus on. The first area of impact is around, I would say, clinical outcomes and just care delivery as a whole, right? The way that Memora really kind of operates is, step by step, patients will get a lot of these different pieces of guidance in this entire messaging journey that I outlined entirely over text message. And the intention is now they have much more proactive, almost daily education and guidance and symptom management surveys and patient reported outcome surveys that they're receiving that are very, quite frankly, just indexed on making sure that we're understanding how a patient's actually performing and making sure that they have access to the right resources that they need, right? So the first is changing the entire model of, rather than a patient experiencing a symptom, not necessarily understanding why they're experiencing it, and then reactively potentially coming to the emergency room, asking a high volume of questions to a care team, right? Making that entire model much more proactive, of guiding them through what they should be expecting, how to mitigate it, how to handle it if it does happen. That's one really big bucket around outcomes, right? And how, around reducing things like ED visits, around making sure that patients are able to keep particular physiologic metrics in track, right, and in control, right. The second really big bucket is around, I would say, just kind of care coordination and care team satisfaction. So one of the biggest areas where Memora has seen value, and particularly I would say this has been bolstered by the pandemic, is the fact that you know every single care team wishes they had more resources that allowed them to communicate with their patients more effectively, that allowed them to focus on the actual clinical concerns of those patients rather than all the administrative pieces of spending lots of time documenting and coming in every single morning and having to do chart review to figure out what patients you have to follow up with, and answering hundreds of messages that come in from your patient portal. And Memora makes that process a lot more efficient, and we're able to on average eliminate close to around 40% of the notifications that care teams are receiving in the status quo by making sure that, one, patients are now put on much more prescriptive journeys so they understand what should be happening and what they should expect. But then second, also introducing a very simple layer of automation that allows us to take data that patients are reporting and make it into one concise and cohesive view of what actually needs to be done for that particular patient, right? So I would say that's the second big bucket. And then the third big bucket is, at the scale that Memora operates now, having worked with a little over 50 healthcare organizations, having partnered with major kind of leading academic and community healthcare systems across the country, and having, raised, I would say, a significant amount of money now just to support the scale that we're growing at. Memora sees tons and tons of data on good and bad practices of care and good and bad standards of care that should be implemented. So we have a lot of insight into understanding what types of follow-up workflows work well for different types of complex patients, what types of engagement practices work extremely well, what types of populations experience different types of complications after they've had a particular healthcare visit. And a lot of that insight gives us, to some degree, the right data as well as the right perspective to determine if we wanted to, over time, develop better gold standards of how different types of complex patients can be managed. This is the starting point for doing that. So the ideal kind of end state of hopefully what we can build Memora into is, if you have a cohort where you want to identify for a particular, let's say, patient above the age of 65 that has multiple comorbidities, that is going through a cancer diagnosis, what is the best way to manage that patient? What is the set of different complex workflows that can guide that patient through all the facets of their healthcare journey? Memora should be able to point you in the right direction.
And when people think of basically, this is something I wanted to make sure we went across or discussed today. When people think of digital health, which is definitely a term we've heard more over the last 2 years than for a while, right? And someone said a quote the other day that I don't know who it is, or I'd give them credit, but basically in the future, it won't be healthcare. Everything will be like digital health in some capacity, right? If you don't have a digital health component, you'll be left in the dust, and you're not truly providing value to patients and others. But in terms of when people think of digital health, they usually think of an app or a patient interface. Now, earlier you mentioned how you do this all text based. That's your focus. Why is that important?
Yeah, that's a great question. And I think that generally, if you think about kind of the traditional perspective on how people think about innovation and technology and the next generation of tools that they're going to be using, people naturally think about mobile apps. People think about social media tools that they use. People think about really cool cutting edge devices that they may have access to, right? Like Aura rings and Fitbits and things like that. And one of the kind of fundamental concepts that Memora has really anchored around is just the concept of meeting patients where they are. And the reality is that, we talk to thousands and thousands of patients and hear and see insights from thousands and thousands of patients through, user research interviews, through usage data of our platform, and realize that, the large majority of patients are not necessarily interested in the most cutting edge tools. They're not interested in having another app. They're not interested in necessarily having some complex process or some really fancy design that they have to go through in order to get answers to simple questions. Quite frankly, a lot of these people are sick, and a lot of these people really just want answers to very simple questions and want very simple guidance and want it in the easiest possible format that they can get it in. And in a lot of cases, that's text message. So there's I would say two statistics that really stand out. One is that a little over 98% of people across the United States now use text message consistently on a daily basis. That's one. And then the second is that, particularly in the context of Memora, we support a lot of other channels. We support, email based outreach and phone based outreach, and we've experimented with the concept of, building a mobile app and the concept of building a web portal and everything in between. And we do want to be an omni-channel partner because every patient does engage differently and every patient does look a little different. But at the end of the day, the overwhelming majority of those patients prefer to use text. One, because the activation barrier is extremely low. It's an intuitive, understandable interface for them. And then second, because it's quite frankly the quickest way that they can receive information, and feels as if to some degree they have an actual human touch with their care team. And I think that making sure that you're anchoring particularly to the needs of the patient, but then second, building a tool that works holistically regardless of the socioeconomic status of a patient or regardless of the population that you're dealing with is extremely critical, especially if you're focused on the most complex patients.
Absolutely. I'm glad that. By the way, your explanations of why you're going with text based and why you started up. I'm glad that you went into it the way that you did. Um, everyone has a different way of explaining their kind of why, how, what, but I like how you transitioned into all of that. I had to let you know that before we wrap this up.
Appreciate it. Thank you.
Absolutely. Well, once again, I want to really thank you for coming on the podcast. I hope we can have you on again soon and we can dive into some more issues. This is really just your intro podcast where people get to learn more about you, the company, through Slice of Healthcare. And hopefully we can have you on again real soon to kind of dive into some other issues. But really appreciate your time today. And thanks so much for being a guest.
Absolutely. Thanks so much for having me on, Jared.